Today I wish to talk about something that's very close to my heart, liver cancers. I have seen so much of suffering, so much of death due to liver cancers. But my message today is one of hope. Liver cancers now have very good treatment, and do not get disheartened even if you're unfortunate enough to have that diagnosis. My message is, I have got patients with me whom I've operated 5 years ago, and they are fine, they're traveling the world. I'll tell you a story. A man who was 72 years old visited me in hospital about 3.5 years ago, and he had been diagnosed with liver cancer. And he had been to many hospitals and they said it is inoperable and nothing can be done. You're 72 years old. I think there is no hope. Just prepare your family. We had a closer look at it. Because we are liver transplant surgeons, we have techniques that we can use, and we managed to remove his tumor. About 3 weeks ago, he came back to clinic here and showed me a picture of him in the tulip fields in Holland with his son. And he said, "Doctor, last 3 months ago, I went to Europe for a holiday, and my son took me all around Switzerland and Holland and Italy, and we had a great time." And I couldn't help thinking that this is somebody who 3.5 years ago was 72, now 75, who was told he has not much time to live. So, first point is, if you have any unusual symptoms like fatigue or tiredness, weight loss, jaundice, which is the yellow discoloration of the eyes, or if you have any worrying illnesses like diabetes, fatty liver disease, or you consume a lot of alcohol, or if you've had jaundice in your childhood, all of these things, please get yourself a simple ultrasound. It only costs about 1,000 rupees or maybe 1,200 rupees, the same price that you will pay for one meal for a family, can save your life. And if we find such a liver cancer and it is found early, there is a huge spectrum of treatment, starting from just burning that cancer with a needle through the skin, to removing that cancer if it is in some small part of the liver and the rest of the liver is healthy, and even if unfortunately it is come along with chronic liver disease, then we can do a transplant. And in all of those things, there are people living for years after such treatment. The unfortunate truth is that liver cancers often coexist with chronic liver disease, with cirrhosis. Because what happens is the repeated damage to the liver from viruses or alcohol is what starts these cancers going. And that is why 80% of liver cancers happen in livers that have got liver disease, such as cirrhosis. And that's why it has got such a bad reputation, because nobody is happy to treat such complex problems. But because at South Asian Liver Institute, we are able to deal with both the transplantation as well as handling the liver disease, we feel comfortable in handling both. Even if it is not operable, or even if it is not curable, there are what we call treatments that we can use to prolong life, such as TACE, TARE. These are things that we can use to give chemotherapy directly into the tumor and prolong life by 6 months, sometimes even 2 years, even in advanced stages of cancer. So my message is, yes, liver cancers are serious and I wouldn't like to have one. But if we unfortunately have got one, do not lose hope. There is a lot of treatment. Do get specialist advice. You're welcome to speak to us. We offer online consultations, and we can at least give you an idea of what can be done. And if we can't cure it, we will most of the time have options to at least prolong life.